Welcome and good evening.
Thank you so much, Tina. Good morning, good afternoon, evening to everyone, wherever you are. As Tina mentioned, I would be greeting you from this part of the world in the Western Pacific region. My name is Shereen Ayub, and I am a risk communication consultant with WHO Western Pacific region, otherwise known as WPRO. And today I'm joined by my colleague, Jun Orbina, as Tina mentioned, who is Communications Officer with the WHO Philippines Country Office. So this session today is divided into two parts. Firstly, I will provide an overview of how WPRO has been utilizing social listening tools for public health. Then I will pass the mic to Jun, who will provide a case study on how social listening has been used at the country level in the Philippines during the COVID-19 pandemic. Jun and I are excited to be here today, and we hope our insights may be helpful to your context. So there's a lot of text here in a limited amount of time, but the point here is that we have seen that the use of social listening has expanded both at the regional and country levels since 2005. There was a scale up across the region in terms of social listening strategies and systems. Here's a mapping of how the region has been building capacities in social listening to leverage ground sensing, not only during COVID-19, but we hope to see this beyond the pandemic and be something more sustainable. What you see here is the overall strategy that's been applied in the region, starting from identifying and leveraging manual social listening tools and building off of each additional tool to optimize the larger system. Optimization includes use of perception surveys and working with partners like local NGOs or social media companies. And during the COVID-19 pandemic, most countries adapted the plans that they had already developed or were continuing to develop and applied it specifically to respond to the COVID-19 emergency. While that mapping is much more conceptual, we do have examples of more tangible products and results from using social listening. There are many examples, both offline and online, but I'll use the example here of how social listening findings supported in the development of targeted COVID-19 messaging that were then broadcast on WPRO social media platforms. What you see is the strengthening of dynamic listening through manual listening and social listening software, supported in really hearing conversations happening at the country levels across the region. Listening to the conversations that people were having on transmission, protective measures, NPIs, you name it, and then production of our health promotional materials incorporated these nuanced on-the-ground insights. Some quick lessons that had been learned. Social listening can be extremely useful in guiding a public health response. And yes, I think we all are here with that same sort of agreement. And it's helped us in digging up messaging from communities to better inform the work we do as strategic communications specialists. That being said, countries can benefit from listening to their communities more, whatever method that may be, offline, online, in order to better identify certain knowledge, attitudes, and behaviors at the ground level. Partnerships can be extremely helpful, whether that's with tech companies or local NGOs who can help with more offline listening. And lastly, something is better than nothing. And I really want that to resonate. We have found that it's not completely necessary to overhaul everything you have now in terms of social listening tools and spend a lot of time creating a new system. Whatever you already have now, especially in times of an emergency, even if that's just periodic manual listening, that's still a core tool. Use that and do what you can and build from there when the capacity is available. So that's an incredibly quick snapshot of what's been going on in the region. But now I will turn the mic to my colleague Jun, who is based in the WHO Philippines office and can speak more on the country level experience. Jun, over to you.
Thank you very much, Shereen, and good afternoon, good morning, good evening to everyone. In the Philippines, the WHO Country Office has been supporting the Department of Health, or the DOH, in multi-source listening, particularly in online listening. The weekly insights gathered from online listening are analyzed with insights from other sources from the DOH side, such as media monitoring, pulse and surveys, chatbot and hotline queries, and community conversations. Listening has been particularly important in the COVID-19 vaccine rollout in the Philippines because some of you might know that we are in a highly politicized context, and the perceptions on new vaccines are heavily influenced by the country's recent experience with the dengue vaccine rollout. So at the start of the year, we supported DOH, or since the start of the year, we have been supporting DOH in monitoring how our desired COVID-19 pre-rollout messages, the ones you would see in light blue bars here, we're cutting across other chatter on COVID-19 vaccines, which are in dark blue bars shown in the slide. These were measured on the DOH Facebook page, which currently has 7.6 million followers. Each bar represents a conversation theme, and the length of the bars represents the volume of interactions. So DOH has been using social listening insights in developing and publishing compelling online content, and we have been seeing how pre-rollout messages were also rising in prominence among other online conversation topics. Subsequently, we have been seeing an increase in the share of voice of the DOH Facebook page as a primary or central source of information for COVID-19 vaccines. Next, please. Social listening is also being used to monitor rumors, misinformation, and disinformation. And we will share with you an early example which has somehow set the tone on the manner of how we respond to future or to subsequent rumors. Earlier this January 2021, we have detected the recirculation of a year-old that was January 2020 news on mask use. This contained old advice limiting the use of masks to health workers and those with symptoms. WHO recommendations on mask use, as we know, have been updated last August 2020. The reposting of old news has created confusion with those who have read the post without checking the date, and the old recommendations were also not aligned with the local guidelines. So to some, the news fuels further skepticism towards health authorities such as WHO at such a crucial time where people are looking for trusted organizations for information on COVID-19 vaccines. Next, please. So using available tools, we sought to understand the situation by determining the spread of the reposted news and the conversations on pages which did the reposting. And seeing the limited spread on the number of pages and the kind of pages, we have decided on a more conservative approach rather than a direct reactive messaging from WHO Philippines. The latter could have driven further attention to the mis or disinformation. Next slide. So what we did was we instead commented on individual pages which reposted the news and highlighting the date of the news and pointing the conversation to updated and official mask guidance from WHO. And some of the pages immediately took their posts down. We also coordinated with a media outlet, which was the source of the old news. The outlet promptly updated the social media version of the original post, indicating that the article is a year old. And we have also increased messaging and proper mask use on the WHO Philippines social media channels. There were no further spread and news pickups 24 hours after the interventions. So this is early example of the cycle that we have been using of listening, understanding, deciding on our action, engaging and monitoring, and back to listening has been useful as we continue to address rumors, misinformation, and disinformation. At present, WHO Philippines continues to support our colleagues at the Department of Health for social listening in shaping online conversations, in rumor monitoring and management, and we also look forward to expanding the capacity in the country to create a more robust and more national, subnational kind of a social listening ecosystem. Back to Shereen.
9 minutes.
Thank you so much, Jun. I think it's so important to hear from and actively listen to and learn from the voices and practical experiences at the country level. So really, thank you so much. With that, this concludes this first session here on regional and country case studies from WPRO in the Philippines. Again, Jun and I hope that the experiences we have shared today can be valuable and useful to others in their work. Thank you very much. Back over to you, Tina.